Good morning. Welcome to Community Spotlight. My name is Blaine Kimball, and we're going to be talking to Pat, I'm not sure I pronounced your last name right, Pat Kreitler?
That's correct.
Is that correct?
Yes.
You're director with Arizona Care Hospice, correct?
That's correct.
And you have an office right here in Payson.
We do.
Besides your operations in the valley.
Mm-hmm.
We're going to be talking a little bit today about some of the myths and the truths about Arizona Hospice, because there are a lot of myths. I hear people all the time say, oh, well, they do this or they do that, or they're going to give you medicine to put you to sleep and you never wake up. All kinds of crazy stuff.
Sure.
So I think today let's try to dispel some of that information and give the right information out so people really understand what hospice is. How long have you been with them?
Well, I've been with him about 4 years, on and off throughout the 4 years, doing various roles and functions there, primarily in education and compliance. But I've been in hospice for 22 years.
So you have a lot of experience
Yes.
and background
I do.
in the business itself. First of all, let's talk about some of the myths, and
Okay.
I'll kind of put them out there, and then you can kind of respond so people can get
Sure.
an idea what the reality is. I think the first one, to be eligible for hospice, you have to be in the final stage of dying.
Well, there's some truth to that, and there's a myth to that as well. First of all, Blaine, thanks for having me again. I always look forward to coming to Payson and spending some time with you guys. There is a lot of misconceptions about hospice, and primarily what the criteria calls for is someone with a life-limiting illness. You don't have to be actually dying. We know that everyone is going to pass on at some point, but for the criteria to enroll in a hospice program, whether it's ours or anywhere across the country that is certified by Medicare, the federal guidelines stipulate that they have to have a life-limiting illness with a prognosis of 6 months or less. Doesn't mean you're going to die in 6 months, just means that you have a prognosis of that.
Yeah, because I was going to say, I know my dad was on hospice, and they had given him just a short time to live, and he certainly outlived that 6-month period. The hospice was right there the whole time.
Well, that's very common because we have found that people that are on hospice services, because of the good care and the compassionate care that they receive, they tend to live longer than what their life expectancy is. And that's a good thing because it's really about the quality of life that you have and what you want out of that quality of life. So we work around the goals of the patient and their family, what exactly it is that they want to achieve while they're on the hospice program.
And I think the next thing that people, and I've heard people say this, I probably even thought of myself a few times, and that is that when you go into hospice, you've given up. I'm done.
No, not at all. And that is one of the biggest myths that we hear all the time out in the community. The word hospice itself, for some reason, has that connotation that this is the end. It really is about living. It's about living whatever time you have left with a life-limiting illness and having us take care of those symptoms that you are experiencing to make you comfortable so that when the time does come, for whenever that is with your illness, that we have prepared you, we have prepared the family, you have your life planning in place, and your goals have been achieved.
And the other thing, I guess, is because you go into hospice because maybe you get a diagnosis that says you have 6 months or less, and then something happens or new things come along medically, they change that prospect, you're still stuck with hospice. You can't go back on regular care. Is that true?
No, that's not true. The good thing about hospice is it does allow you to come on and off of service if you do change your mind and want to pursue aggressive treatment. Remember, initially, to come on to hospice, we talked about this the last time I was here, that in addition to having the life-limiting illness with a prognosis 6 months or less, sometimes people do get better, and sometimes they change their mind because you have to forego aggressive treatment. It's all about comfort care. So if you come on to service and you decide a month from now or 2 months, you know what, I've changed my mind. I really don't want to pursue a palliative care. I want to have aggressive treatment. I want to be able to go to the hospital and have treatments. Then you can revoke the benefit. You can come off, and then you can come back on when you feel that you're ready. So it's got that flexibility for the Medicare beneficiary, if you will, or the hospice patient to have that option.
And Medicare allows that too.
Yes, they do. They do.
And that's a lot of concern for people because if Medicare is paying and you go off,
Right.
well, you can't come back on. You've already used your benefit. That's
Well,
the
here's the
problem.
nice thing about it. It's covered at 100% under Medicare Part A. And that includes all the services, the people that come to visit you, your medications, your supplies, your durable medical equipment. It covers all of that. And there is no out-of-pocket cost and there's no copay. So if you have Medicare, then you need to be rest assured that if you need the services and you want them, it's covered at 100%.
And while we're on that subject, because I don't want people to just think Medicare is the only way that
No,
you can get
right.
care through hospice, correct?
Right, there are other ways. First of all, most hospices do accept commercial insurances. So if you don't have Medicare or you're younger than 65 and you haven't been disabled and you have a commercial insurance, it behooves you to tell your hospice provider what that is, because there's a lot of good commercial insurances that have a hospice benefit as well as a home health benefit. And sometimes if you don't have a hospice benefit and there is a home health benefit, the insurance company may be willing to convert that benefit over to hospice. In addition to that, we never deny people the service for inability to pay. So we do take people that have no insurances at all. And that's pretty much universal throughout all hospices.
It is. So
Yes.
You're
And
the-
Medicaid as well.
And Medicaid. Okay.
Mhm.
So let me ask you this. A lot of people think, I think a lot of people think, cancer and hospice kind of go hand in hand. That seems to be the disease that,
Sure.
but that's not totally true either, is it?
No, there are a number of illnesses that people get through their lifetime that may be life-limiting. Cancer definitely is one of them that has a life expectancy that varies, that could be within, a 6-month time frame. But there's also end-stage respiratory diseases, end-stage renal diseases, kidney, liver, heart. There's all kinds of other things that we could get, unfortunately, that could be to the point where there is no more treatment, or the treatment is affecting you where you don't want to pursue it any longer. So there's other types of diseases that we do take people on service for, and Medicare recognizes that. So they have criteria that we follow for each one of those, including the ones that I just mentioned.
And that would be things like Lou Gehrig's disease or
Correct.
Parkinson's or
Correct.
any of those kinds of diseases
Yes.
that are progressive to the point where
Progressive diseases,
at some
yeah.
point you're going to reach the point where you only have
Right,
some-
and there are a lot of those neurological diseases that are progressive in nature, but it depends on when it's diagnosed. If it's caught early enough, then maybe hospice isn't the right avenue for you at this time, or it may be one of those disease processes that has been widespread for quite some time, and you've tried different treatments, and now you've decided I really don't want to go this avenue anymore.
And I think the other thing that we've kind of covered is that hospice just hastens your death, and as you said, that's
No.
totally
Right.
Actually, you're finding that that's almost the opposite.
Correct. Yes. No, we do not hasten, prolong it in any way. We allow nature to take its course for whatever time you have left. So what we typically do is we treat and manage the symptoms. We design a very specific plan of care for each patient and family. And remember, we're not just taking care of the patient, we're also taking care of the family as a whole unit and preparing them and helping them and teaching them, because they have caregivers in the home. And we found that over 90% of people want to die in their own home. So the majority of our patients are cared for right in the home that they live in, wherever that might be.
Yeah, I can tell you right now with my dad that he lived much longer because he was in the home. If he had
Right.
stayed in the hospital, I firmly believe that.
Yeah, and I think we've heard it from testaments from our own patients about where they want to be, who they want to have around them, what kind of things or systems they want to put in place. I mean, the biggest thing that I think we can take away from this is it's a wonderful service, but end-of-life planning is something that we don't typically talk about with our relatives, and it's so important to do that. I just had this conversation with my 90-year-old father-in-law just last week about the fact that he didn't have a power of attorney, a medical power of attorney. And it's important for us to talk to our doctor, to talk to our family members about putting those in place so that when the time comes, we don't put that burden on our families to figure out what to do, kind of thing. We are definitely doing whatever their wishes are.
Yeah, there's a plan in place.
Correct.
As opposed to trying to create the
Exactly.
plan under stress.
Exactly.
Which is
Yes.
a totally different situation.
Yeah, you're absolutely right, Blaine. That's true.
And I think the other thing, I think people have one perspective about hospice.
Mm-hmm.
You go there, they come in, they put you on morphine or whatever the case might be because you have pain,
Right.
etc. And that's pretty much what you get. But that's really not true. You have a whole team of people,
Right.
correct?
We have a whole team of people that go in. We have nurses, obviously, and physicians and nurse practitioners. We have home health aides that handle the bathing and the dressing, and we have volunteers. We have chaplains and social workers. So we have a whole bunch of people that go in. But primarily, the medications are around the discussion that we've had with the patient about treating those symptoms and making them comfortably. Yes, it's true. We do use morphine for certain things at certain times, but we base that on the needs of the patient. And we don't give any more than what is needed to control those symptoms at that time.
And the other thing, I guess, that people don't really understand, you can still have a primary care doctor, too. If you've
Yes.
had a family doctor your whole life,
Mhm.
he doesn't have to necessarily be out of the picture in this whole process.
No, that's one of the questions actually that we ask upon admission. Which physician would you like to have follow you while you're on hospice? Do you have a doctor? Obviously, if they don't, we do have, hospice doctors and a hospice medical director. They can certainly choose those. They can choose their own nurse practitioner as an attending, and now physician assistants can be attending on the hospice side. So they have the option of picking who they want based on their choice. And if they've had a family doctor forever, obviously we have to get him or her to agree to follow, but that usually is not an issue, and we'll call them and get that taken care of.
Here's the other thing that I didn't know until I was looking over some of the information about hospice that I think is number one, I was kind of amazed that it actually existed,
Mm-hmm.
but I can't believe how important the benefit actually is. And that's the bereavement care after death for the family.
You bring up a very
members.
important point here. The bereavement is, we follow our families for a year. That's a federal requirement in the what we call conditions of participation that we agree to participate in to be Medicare certified. And we provide grief support groups in all locations. We have a location here in Payson. We provide grief support here, as well as all of Maricopa County, Pinell County, and Gila County. So we do follow our families. We make phone calls. We send letters. We also do individual counseling if needed. And if someone needs to be referred out for anything related to complicated grief, say, then we will put them in touch with counselors that can specialize in that as well.
Yeah, I think that's the benefit in and of itself that people probably don't even think of when you talk about hospice.
Right.
And to me, it's probably one of the more important benefits because the people that are left behind are the ones that still have to deal with
Well,
problems.
that's the hardest part. And it's funny. Grief is a funny thing because I have witnessed people being fine at the death and being fine even weeks and months later. It could be a year down the road when grief suddenly hits you that person is no longer here, or you may be in a grocery store and peanut butter cookies remind you of your dad or something. Then the grief starts surfacing, and that's when it's hard for them to deal with it. So we are available at both offices for grief support at all times. And I think that's important for people to know that there is help out there if they need it.
Yeah, because my mother's 96, and she still lives on her own.
Oh, great.
And so my dad's been gone for about 6 years now.
Yeah.
But there's still times when I talk to her where something has happened during her day
Yeah.
that reminds her,
Sure, of him.
and she goes back into this time of grieving.
Yeah.
So-
Well, it's nice to remind them of the good memories that they have and look at pictures and talk about him. I think your mom, you'll probably find, will love talking about your dad because, this is the part that she misses the most, and this is what she wants to bring to the surface. It helps her, work through that grief that she has. So it's real important to talk about those that we've lost.
Yeah, because they traveled a lot. So that's what
Oh, did they?
And so that's what she talks about a lot when we have conversations. And I call her every day.
Oh, that's
in the
nice.
evening.
Yeah.
But that's one of the things that probably she misses it the most, but it's
Yeah.
the thing that brings her the most comfort. Too,
Sure,
those memories
sure.
of, we went here and we did this,
Yeah,
and we went there
yeah.
and we did that. So I can see what a benefit
It's
that
funny
actually
how a
can be.
memory will surface. I mean, I have it too with when my dad passed away. And it's been 10 years now, and every once in a while something will remind me of him. And the funny thing is that those are good memories. And I think even if the memories are not so good of something that you think about, it's good to work through that because there's always something good to come out of that.
And I guess the other thing that we really need to talk about, because you have an office here in Payson, you're much more close to our community now than when we just had your office in the valley.
Correct.
And I'd like to talk a little bit about your facility here and
Sure.
what's available here, how people can contact you, what they need to do if they're reaching a point where hospice becomes a reality in their lives, and
Sure.
how they choose good care.
Right,
Because
right.
it's kind of like doctors or hospitals or any other thing. There are good facilities, and there are some that necessarily may not be as good. So, what do you recommend, and what should they be looking for?
Well, we do have an office here in Payson, right up the street from here. Actually, it's at 1100 North Beeline Highway. We are in Suite A in Payson, and our phone number there is 928-535-5353. And anyone is welcome to come into the office at any time. We don't actually have patients in the office, obviously, because we treat them in their own home. But should they require a higher level of care, then we have multiple things that we can do. The first thing we can do is we make visits in the home, obviously. And we also have after hours. So you can call anytime within a 24-hour period.
So these are the kind of things that people should be looking for?
Right. These are the things that people should be looking for. You want to ask the hospice, how many visits do you typically make? Who comes out and sees their loved one? What is the phone number? Do you have visits after hours? Do you make those kind of things? Are you accredited by Medicare? Are you certified by the state of Arizona? Are you accredited by any accrediting bodies? Also, Medicare requires us to provide 4 different levels of care. So one of those is respite care, where we give the caregiver a break. So you want to know, who are you contracted with to provide respite care should I need it? Or general inpatient care, if there are symptoms that can't be managed at home, who are you contracted with to take care of those symptoms, and where does the patient go? So for us here in Payson, we are contracted with KRIM Country Health and Payson Care Center. So we would definitely be able to use those facilities to put your loved one so that you could have a break for 5 days, or for general inpatient.
And respite care, I hadn't really thought about that quite so much, but I would think that'd be very, very important, because I think it's very, very tough to be a caregiver.
Sure.
Particularly if you don't have other family around to help pick up some of the load for that.
Well, that is also very important to us, because that is a huge job, and no matter who you are or where you are, that is very taxing on the person that's the caregiver. So Medicare recognizes that, and that's one of the benefits, is the respite level of care. So it gives them the opportunity to get some sleep, get some rest, maybe even take a short vacation, because it's for 5 days. So we do provide that, and we are required to in order to participate in the Medicare program.
Now, what if I just need a break? Maybe I want to go out and have lunch with my friends. I need somebody just to sit with the person I'm caring for a couple of hours. Is that available?
Yes, we use volunteers for that, and we have a very good volunteer program even here in Payson. So there's a lot of opportunities for that. So if you are thinking about looking for some community service or wanting to volunteer, definitely call our office or stop by, because we do encourage people to do that. We do extensive training for our volunteers. We'll do it one-on-one if they don't have the time for that. And those are the folks that we use to sit with the patient while the family goes to the doctor's office, goes shopping, goes out for lunch, goes for dinner, those kinds of things. And if we don't have one available in that vicinity, then one of our staff members would definitely be able to provide that.
And I guess the other thing that comes to mind is, along those same lines, maybe it's not going out and leaving the facility, but sometimes when you don't have anybody else to talk to,
Sure.
You just do a family visit. So come in and just chat with the person who's the caregiver, so they feel like they're not just isolated.
Well, you have to remember too, there's multiple staff that go into the home. So between the chaplain, the social worker, the nurse, and the CNA, there's somebody in the home probably every day of the week or close to every day of the week. So there's always somebody coming in, and most of the time we find that our caregivers are very appreciative of that, because then they do get to talk to somebody every time they come in. And so typically we find it's on the weekends that they might ask for an extra visit. Maybe they need extra supplies, or they just want someone to talk to, or they want to review the medication. Because remember, the caregiver is the one caring for the patient when we're not there, because we don't live with them. But we'll make as many visits as necessary to make sure that things are running smoothly, that the patient is comfortable, and the family has what they need.
I had no idea that you'd have somebody coming in there on that frequent a basis. Almost every day, there's almost always somebody there.
There's always somebody there when you think about it, because there's so many team members that are seeing the patient. The only way we wouldn't have that many is if the patient and family decided they don't want to see the chaplain or social worker after the initial visit. But most of the patients do, in some capacity, want to do that. And sometimes they have friends that come in. They may have their own pastor or clergy that they want to be in contact with. So we'll make contact with them, and they'll go in and see them as well. So typically we find that some families get overwhelmed. So we don't want to overwhelm them by having too many people going at the same time. So we'll ask them, what days of the week work best for you? What time works best for you? And then we'll work around their schedule.
So you really provide a level of service, I think, that most people out there don't really realize until we sit down like this and we talk about all the things that are actually available. Even though my dad was in hospice, that was in California, and I was here, so I wasn't there to see the day-to-day stuff. My sister was.
Yeah.
She stayed with my mother and dad during that time period, but I wasn't, so I had no idea that it was as extensive as this.
Well, I would encourage any listener that wants more information. You know, maybe your loved one, you don't have a loved one that has a terminal illness, which is wonderful, but you want more information so you can prepare for the future. There's a couple of things we can do. I mean, feel free to stop by the office. We also have booklets that we give to patients and families that talk about specifically hospice care and answer all these questions that you and I have been talking about today. And in case you don't remember some of the things that I've said, because it is a lot of information, the booklet is free to anyone that wants to stop by and get one. And we do drop them off in the community at all the businesses, but you know, we may have missed someone, or someone would like extra copies. Please feel free to stop by our office. And we're also going to drop some off here at the radio station. So you'll have a supply of those in the next day or so, if people want to stop by here too.
And that would be great. And I think that you bring up a really good point. Even though you don't need hospice care for a relative, you may need hospice care yourself in the future.
Sure.
And it's good for you to have an understanding of what's available, because you may have to educate your family when the time comes.
Right, and that's what we find is the biggest thing, is not really understanding why someone would want hospice and understanding what it's for. But the end of life planning, you know, the power of attorney and getting your affairs in order is something we don't talk about every day. You know, advance directives are extremely important, and we can help you with that, even if you're not on service. We can provide you with those forms. You don't need to have an attorney to do an advance directive. We can download them from the internet, or you can download them, and we can just give them to you, and you can do them at your leisure and fill out, you know, what your wishes are. So it's important for people to have information, not just about hospice, but about end-of-life planning as well.
Pat, what else would you like people to know about Arizona Care Hospice before we wrap this up?
Well, thanks for mentioning us. I really appreciate it, Blaine. We are a wonderful hospice with very compassionate people. The thing that I think sets us apart are a couple of things. One, our nurses have very small caseloads. We make it very manageable for them so that the people that they're seeing, they have the time to spend with the patients. Whereas some of the hospices that are a little bit bigger may not have the resources that we do, because we allow them to do that. The other thing is we have very little, if any, turnover. So our staff have been with us for many, many years. And it says a lot about the kind of employees we are and the kind of employer we work for. So our owners are very committed, they're hands-on, and they provide us with everything that an employee would need. And it's a great place to work.
So if you're out there, one more time, let's give them the phone number and the location, just in case they need that information. They didn't get a chance to write it down. Get your pen and paper handy, because we're going to give you the address and we're going to give you the phone number one more time.
So we are Arizona Care Hospice, and we're located at 1100 North Beeline Highway, Suite A in Payson. We're right across the street from the bowling alley, if you know where that is. Our office number is 928-535-5353.
We're so big, I think everybody knows where the bowling alley is in Payson.
Well, I just thought I'd mention that anyway, because sometimes, the buildings
That's
are so
what I
close
mean.
together, and you want to make sure you have the right spot. So,
Yeah,
but feel free to stop by. We love to have company and see people.
So if you can find the bowling alley, across the street, you'll find the Arizona Care Hospice.
Right.
Hey, thanks for coming in today. We
Thanks for having
appreciate it.
me again. I appreciate it.